¿Me subes un poquito la música?
Hello everyone, and welcome to this special podcast from the Kukulcan Spanish Community. I am Cliff Davis, and as usual I'm joined by Carmen Diaz, one of our professors and academic coordinator. Hello Carmen, ¿cómo estás hoy?
Muy bien, gracias. I am a little nervous today because I have to talk in English and I am out of practice.
Well, don't worry Carmen, I promise you that once we edit the show together you're going to sound like a native.
With the magic of technology.
So Carmen, tell us, why is today's show in English?
We are going to speak English today because we are going to talk about two of our customized programs. One is for healthcare professionals and the other one is for dietitians. And we want to be sure everybody understands what are we talking about.
We're very honored today to have with us a very special guest, Bruce Rangers, Associate Professor of Nutrition at the Metropolitan State College of Denver. Hello, Bruce, and welcome to the show, and thanks for coming today and helping us explain the healthcare programs at Kukulcan.
I am very glad to be here.
This summer, Bruce has been working with the directors and professors at Kukulcan to put together a new Spanish program specifically designed for dietitians. This program is an adaptation of the existing programs for nurses and healthcare professionals. So, Bruce, you have been here at the school for how long now?
I've been here for 4 weeks.
And what is your impression of Kukulcan and the Spanish programs that they run here?
I think Kukulcan is pretty amazing. The classes here are very small in size, and there's a lot of individual attention. There's enough classes that students of all abilities are able to find a class that fits them. The teachers are very adaptable. For instance, this summer, as we're trying to start this program in nutrition, professors have just been outstanding in terms of helping us to create special classes with vocabulary for nutrition students and to create situations and field trips for nutrition students to help them learn the language and the culture of Mexico.
And are you having a good time while you're here?
And of course, it's a very good time when one is here in Cuernavaca. You know, it's the city of eternal spring. And so the weather has been terrific. And the people here are very, very pleasant and very friendly.
As well as working on developing a new dietitian program, have you been taking Spanish classes yourself?
I have been taking classes myself because I realize how important it is for me as a healthcare professional and as a dietitian to be able to speak Spanish to better serve the clients in our communities.
And how were your classes?
My classes were really great. I really enjoyed the small size of the classes. The professors are very well trained and they have very good teaching techniques. So in addition to learning a tremendous amount of information, probably more than I would learn at a university in a whole semester, here I get all that information, but it's also a lot of fun because you meet a lot of great people. The classes are designed to be pleasant and to be fun and to make learning fun and to be interesting.
Why do you feel it's important for workers in the healthcare profession to learn basic Spanish and to understand some of the cultural differences between American patients and Hispanic patients?
I've had experience before running nutrition programs in the United States, particularly one known as WIC. And in my clinics, most of the clients coming through were Hispanic people, and many of them only spoke Spanish. And while I worked in these programs, I tried to hire dietitians who could speak Spanish, and during my time, I was never able to find a dietitian to interview who could speak Spanish to my clients. So therefore, we had to use a lot of interpreters, and that's a very cold sort of way and a kind of a poor sort of a way to provide services to clients and to make them feel welcome in your program. So I think it's important that we have basic Spanish so that we can work better with our clients. In addition, a lot of cultural situations often came up that you would not expect. And so I kind of have a story that kind of helps illustrate that. When I was working in one of my first clinics, I was only there maybe a week, and I had a client call and complain because one of my staff had cast a mal de ojo on her child, and she wanted to know what I was going to do about it. Well, from my background, I had no idea what a mal de ojo was, and once my staff explained to me what a mal de ojo was, it was then very difficult for me to figure out how I was going to solve this problem.
So what is a mal de ojo?
Mal de ojo is when somebody, for instance, Carmen, would look at me kind of with an evil eye, and she would put a bad spirit into me, which then would harm my health and make me feel badly. So it's important to understand those things. And being here in Cuernavaca, and I live with a family here in Cuernavaca that's part of the school, I learned so much about what people here think about nutrition and how nutrition works, which is so different than I would learn, say, in a university or a school. You learn that there's a lot of subtleties to that you would never learn in school that are very important to understanding your clients. Mm-hmm. In addition, it's also helpful to know about the food habits and the types of foods that people eat. For instance, many of my clients came in and would describe foods to me that I had no idea what they really were. And I could look up in my dictionary and it would give me a definition. For instance, one that I encountered in my clinic, I would see sopa, which means soup in Spanish. Yet most of the people coming into my clinics, what they called soup and what I would call soup were totally different foods. Mm-hmm. So I've also really enjoyed being here in Mexico, and it's been an important part of my learning is I get to eat the foods that my clients would be eating. So I really get to understand those foods and understand what they're talking about when they are telling me about what they had to eat the previous day.